I spent most of my life overweight, even when I was in the Army and everything. I just struggled a lot.
Leslie King is an Army vet, nurse, wife, and mom of 4.
When I was 40, I gave birth to my 4th son and realized that at the rate I was going, when he graduated from high school, I was going to be an old, unhealthy 58-year-old. His siblings and him deserved a mom who was more active and healthy.
She was 336 pounds when she sought treatment at Mount Carmel Health System in the fall of 2022.
My family's full of diabetes and heart disease, and though I was overweight, I didn't have any of those issues yet, and I didn't want to develop them at such a young age. So I seen the surgery work for my cousin, and I just went for it, and I just needed a change.
The surgery is bariatric, and Dr. Chaz Dabbs is a bariatric surgeon at Mount Carmel.
So bariatric surgery is surgery where we alter a patient's digestive anatomy to help with losing weight, which is the thing that most people are very familiar with, but also with the treatment of diseases that are caused by obesity, such as type 2 diabetes, high blood pressure, high cholesterol, and obstructive sleep apnea.
And what post-surgery recommendations help patients be successful?
So, close follow-up with their physician and the other practitioners in our office is very helpful because we can help people stay on course. We have support groups with our program that people can go to, both online and in person, to help with keeping up and just feeling supported, and then having a good knowledge base for their dietary choices throughout.
Leslie joined those support groups even before her surgery as part of her research.
There's a lot of restrictions with the surgery. You have to watch your carb intake and your fat intake. I joined Facebook groups, support groups. I joined the Mount Carmel support group before I had surgery. And I talked to everybody I knew that had ever had the surgery. Lots of questions.
So who is a good candidate for bariatric surgery?
Anybody with a BMI greater than 40 or a BMI of 35 to 39.9 with any of the obesity-related comorbid conditions, such as, again, type 2 diabetes, obstructive sleep apnea, high cholesterol, and hypertension.
The doctor emphasized that it's not just about weight loss. It's about a person's health and reducing their risk of possibly life-threatening weight-related health problems.
What we do, rather than just kind of temporarily treating a disease or giving a medication to treat a disease, we basically give the patients a tool or a way to manage things themselves. And we're seeing, with those diseases that I stated before, these are all things that we've not been able to really conquer before. In any sense, we medicate, but with bariatric surgery for a lot of our patients, we're able to get them off all their medications for these various diseases. So to take something that was essentially a chronic, life sentence, like you're going to take these antihypertensive medications or these type 2 diabetes medications for the rest of your life, and be able to get people off those meds is really huge.
Leslie has lost more than 175 pounds since her surgery, but it's not just a physical success, it's a mental one as well.
I have become an advocate for myself. As a nurse, I always push my patients to advocate for themselves and speak up when they feel they need more attention. And I was never that patient, and I'm that way now for myself. And I finally love who I am, and it's not because I'm thinner, it's because I feel stronger. I feel more in control, and I'm just so proud of myself, making myself a priority and taking care of myself every day.
Since her surgery, she's taken up running again, and she's training for the Cap City Half Marathon in the spring.
I'm proud. I'm proud of the old me for not giving up. And I'm proud of the new me for standing strong and being a better advocate for myself and for my family and even for my patients. I feel like I can speak to them on a level that they don't normally get, because I wasn't always healthy. I wasn't always thin, per se. And I can say, I used to be like you. And there are options and there are ways to get healthy, and I believe in you. Just look into it. Make it an option for yourself. Don't get discouraged by, people who don't believe in it, do your research. If anything, just get in an appointment with one of the surgeons and have a sit-down talk. And know that you're taking yourself seriously when you make this step, and making yourself a priority is not selfish. It's important. We have a future to live, and being overweight and developing these diseases, we're not going to be here. So go for it.
For more information, visit Mount Carmel Health's website or give them a call.